All right. Hello, everyone. 40 of you. Good attendance today for an off-cycle Dan and Friends. So we haven't had one since I believe it's almost been a week. I think it was last Thursday. So today's Wednesday. I remember when we signed off that we'd have one if things did not go well. And the fact that we haven't had one means things have gone well. Actually, they've gone quite well. So a positive kind of Zoom or Dan and Friends. I'm going to just go over some of the general highlights, and Kris will give you the accumulated top 10, which is in some of our areas we've actually gotten down to quite a lesser number than that. Um, First of all, thank you, everyone. I think one of the biggest things to thank everybody is their attitudes. I think across the board, with our nurses, our physicians, our support staff, all of our providers, we've had really good attitudes to this. I think it has been at times frustrating as we've learned new stuff, and a lot of you maybe have only been on Meditech the last 10 years. And so just switching to anything, even if it's a better system, is a lot of work in addition to all your usual work. But thank you um, for your understanding of that whole process, and again, a good attitude. All the people who supported everyone to make the transition. So from our new grad team to all our, I think one of our physicians call them our yellow jackets, or our yellow hazard. All you need to do is shine a light down the hall and everybody.
Our construction vests.
Our construction vest helpers, really appreciate it. Our super users who were really super, and that's not a pun, that actually was the truth. They really were, have made, I think, the transition go well. And then a lot of our travelers who were out there that had been using Epic in a lot of their various assignments. I heard many stories about how helpful they were. So for those of you who have pitched in and helped and shared all your insights, thank you. That also made it helpful because you could, I think, more directly relate to the care you were providing because you were doing that with your own assignment and could help others. So thank you. The Health Connect team, I think, did a great job with preparing for this and putting in all those hours and also all the legwork that it took to get us teed up and ready to go. You should all take a bow. And also for your guys' attitudes, I think they stayed great. To do something month after month can turn into a real slog. And I've seen teams get really negative and you didn't. So thank you for that. Our Epic, all you folks that came from Wisconsin. So I hope we showed good aloha. And I think you're here for a few more days, but we appreciate all of that help. And I think the weather was at least okay for you, but you didn't get to see it because you were inside helping us. And our Health Connect, our Epic leadership team, Mike and Casey, and a whole number of other folks said that I won't try to name because I'll leave them out and get their names wrong. You guys were really good. Appreciate your professionalism. And then we have, of course, our facilities IT team. So you can't see to the side here, but Mark's here. There's Mark. Way over here. Sorry. There's Mark. Hey, Mark. Mark and Kia and Alex and all the support folks. We had literally thousands of devices that had to get out there and get set up. The system stayed up. We didn't crash the hard, the IT back end. And I haven't heard actually I've heard mostly positives about the speed of the system. So quite the laundry list of thank yous, but I think they're very much needed and they're very appreciated. We've got still a good bit of work to do. We're 2 weeks in or so, a little less than 2 weeks. So there are things that can be persistently troublesome that we need to continue to work on to fix. And then we're doing a ton of work on our revenue side. A lot of people, you don't really see all the work that goes into accurately coding and billing and collecting the money that we honestly earn and we deserve from our payers so we can actually take care of our community. And I wanted to take a minute and just comment on that. A lot of you are seeing that there's this big emphasis on charging for things, capturing things, whether it's the amount of time, a patient is on the unit, or how long we did an infusion, or the supplies you used. And that's very different. We didn't charge in that way in the past. And some of you have probably aware of how a lot of things are paid in the healthcare system, where you're paid this lump sum. So a patient comes in, has a pneumonia, you get a lump sum. So you're going, well, why am I charging this Foley over here and this sterile pack or this infusion? Aren't they just all covered? So the fact of the matter is, they are covered, but there's this big but that happens. So for us, we have to capture all those charges, because every time we go and renegotiate our contracts with our private payers, we have to show through our bills how much it costs to care for that pneumonia patient. Right? So if we're working with the HMSA and we've left a third of the charges off, sure, we may only get a contracted amount. But when we go next year and we go, hey, this is how much it costs, and we don't show that information, we really can't get paid accurately for what we do. And even with Medicare and Medicaid, they do a thing called a cost report. And what they do is they look at that over time and they go, oh, well, this is your base rate that we're going to set for your hospital. And you have to show on your cost report how much it costs for you to provide that care. That is part of the formula to set the fee for how much every patient is paid, whether it be for a sepsis or a trauma, for pneumonia. So when you charge that Foley for that patient, you're not charging Miss Smith, who lives next door, or Miss Kimura over here, and they're going to have a bigger bill. Their insurance is going to take care of it. Medicare is going to take care of it. Medicaid is going to take care of their bill. What you're helping us do is make sure we get paid enough to deliver the service to Mrs. Kimura and Mr. Smith, right? So when we say capture your charges, it's not to stick your neighbors with a bigger bill. It's to make sure our payers pay us, okay? So for all of you out there who are advocates for your patients, and I understand that it kind of feels uncomfortable, this is why we're stressing capture your charges. And we didn't do this in our old system. We didn't have a lot of the tools to do it, but we do in this system. And this is actually how we help pay for Epic and things like this. So I wanted to, share that with you. I'm going to do that on another town hall. I probably get where you're saying God is talking about charging again, until everyone gets really comfortable with the idea of capturing the cost of care. You really have to capture that. So that's enough of my soapbox for the day. But I personally, and I think for my team, appreciate all your hard work. And we still have much more to do with Epic and to get the system really working. But the initial implementation, I don't think we could have asked to go any better. So much mahalo.